Sarcoidosis for us today. Thank you, Dr. Barney.
Thanks.
Do I go this way with this guy? Yeah, there we go. Well, thank you for coming today again and being part of this. I didn't realize I needed Grecian formula, but now I'm going to go home and feel real insecure about that. Wow, I'm one of the old guys now. And that's tough to follow, Alice. Alice and I have known each other just a little bit of time, maybe a little bit. I'm supposed to tell you all about how this disease sort of works in 15 minutes, and that's kind of tough. But what I'd like to tell you probably up front is that I'm guaranteed to have less answers than you are questions. And that's the truth at any meeting for anybody with sarcoidosis. When research meetings occur, or when patient support group meetings occur, is that we don't know enough about it. It doesn't matter how many people get together, there's more questions that occur afterwards. And I will tell you that the only way that we have made things better for this disease for patients is by working together collaboratively with a lot of people participating, like cardiology or pulmonary or people who specialize in pain management or immunology experts working together in concert and with the FSR and other organizations that do that to bring the right people together to get a better product, which is different views of the way it's taken care of and care is provided. So there are a lot of people, to their defense, who are out kind of in the middle of a lot of places where there's not collaborative care that are doing the best they can to take care of patients with sarcoidosis, but they don't have a lot of experience with it. And so that's not necessarily a fault on their perspective, but it's that the way that they view it and think about it is like looking through a keyhole at an elephant on the other side of the room, and there's no way to really understand it without having seen a lot of patients with sarcoid or collaborating or communicating with a lot of other people who know a lot about it. So I'm by far not the most in-depth base of knowledge compared to the people sitting over there to the left of me. What I will tell you is that I was going to talk to you a few minutes about sort of an introduction and sort of a broad overview of sarcoidosis in general. And I thought we'd talk a little bit about what we do know about it as a disease and how many people are affected by it as a disease and what it can do to the body, and give you just a couple of examples of that, and then how people generally get diagnosed with sarcoidosis. And that's kind of a thing that's easy to discuss on the end part. And I really kind of entitled this talk, a big picture with little perspectives, and this is a picture, actually an artistic rendition, a drawing of an artist of how the universe began, and this is what people would be considered the Big Bang. And I show you this picture because our perception of the way the world and diseases work is constantly changing. The more we know, the more we look at it differently. So whether you believe in your own personal beliefs and faith or not, this is what physics has told us, that the universe began from this point, and everything was in, all matter that ever existed is in the size of a cup, and it expanded from this giant explosion and gave forth stars and galaxies and matter and patients with sarcoidosis in that order. And we used to think that before this, nothing existed. And people would say, well, what was before that? And physicists would say, well, as far as we know, nothing. And just recently, several people in the world of physics have decided that actually it's very possible that there was matter and time that worked in reverse before this that all came concentrated down to this little disk and then exploded out again this way. So we used to think that everything started here. And it turns out maybe everything started before there and exploded and then became this, and then from here on out, well, who knows? So perception of the world is changing. Also, some guys used to think the world was flat too. Well, look how that got them. So generally, this is an inflammatory disease. It's very perplexing. It's very complex a lot of times, but it basically shares in every patient who's ever had sarcoidosis inflammation at the core of the disease. And it's a disease manifested by this specific form of it called granulomatous inflammation. And granulomatous inflammation can occur in other diseases besides sarcoidosis. There's granulomatous inflammation in forms of vasculitis, which is an inflammatory disease of the blood vessels. There's granulomatous inflammation in infectious diseases that is an appropriate response to that. In patients who have normal immune systems that don't have sarcoid are trying to clear out infections. But in all patients, uniformly, there are these non-caseating granulomas that occur, which I'll show you in a minute, and these are T cell driven, these white blood cells that are called T blood cells or lymphocytes, that are part of the immune system that are normally supposed to function to help us get rid of infections and to prevent things like cancers occurring in us, drive these non-caseating granulomas in concert with these cells called macrophages. And so these two cell forms work together and create and drive these macrophages in the body. And as a result of that, these macrophages, these granulomas, I should say, will release inflammation in different ways in different patients. And while all patients theoretically share the fact that they have granulomas and they have inflammation from the granulomas, how each patient looks is very different. So one thing that makes it hard to understand sarcoidosis for individual people in practices or healthcare providers is that I guarantee you that among all of you today, there are people with such very different forms of sarcoid where it's affected different parts of the body and it looks different. And there are people with sarcoid that's milder than others. There are people with sarcoid who take medication for a short period of time, and there are people who take medication for their whole life. And so it's a big spectrum of a disease. This is what granulomas look like. This is a couple of photographs. This is from Yale Rosen, who's a pathologist, and this is from Sanjay Mukhopadhyay, which I'm also going to mess up his name. And this is a large magnified granuloma in tissue. And here you can see this lymph node taken from a mediastinoscopy, which is where they take, a surgeon makes an incision and takes the lymph node out of the chest of the patient, and they slice the lymph node up. And you can see that this lymph node is full of these large granulomas, these large, lighter purple areas. And these granulomas are really kind of formed, and I drew this myself, so please don't take this as my art. I'm not an artist by any means. But this is made of macrophages and giant cells in the middle, which are macrophages that have merged together, and these T lymphocytes that surround this and make this granuloma, which would look histologically like the picture before. And this lymphatic flow flows across them at whatever tissue they're in, and these granulomas release cytokines, which are inflammatory proteins. And so, as they're active, they're immunologically active, these granulomas will release and secrete things that get picked up by the lymphatic flow in one general model, and it goes out to the body and it causes people to feel bad. And so this is part of the inflammation that is related to all patients with sarcoid in some way or another. And sarcoid almost behaves like a response to an infection. In a way, many people have thought that this was really an infectious disease, and there's some research that supports the fact that sarcoid is an immune response to an antigen that people pick up, and an antigen is like anything in the environment, like a bacteria or a virus or dust, and our immune systems respond to that by trying to eliminate it, which is normal. And the difference is, in a way, globally, is that patients with sarcoidosis have a response where they get rid of whatever's triggered their immune system to be active, but their off switch is not working. So their immune system continues to be activated or on, in a way, even though whatever happened to them that triggered it is gone. And so that is one general sort of global difference between people with sarcoid and normal immune system responses. And you can see here that this large circle would be the lung, and this is like the compartment of the lung, like the alveolus, the air sac of the lung. And here's this antigen that we breathe in this model. This antigen comes in, these macrophages, which are cells that are our immune system, gobble it up. They kind of consume it, put it into smaller pieces. They show the pieces to these T lymphocytes, which are going to get programmed to help the immune system get rid of whatever they see. And then these T lymphocytes come and program these blood monocytes, which are also immune cells, and they circulate around and make granulomas. So this is a constructed model, but what it shows you is that in one way, people with sarcoid are exposed to something, many things probably. They get it inhaled, their lung consumes it up to get rid of it, their immune system sees it, and then their immune system programs these other immune cells. And from there, granulomas are formed, and then it kind of propagates itself. So this is one construct way of how pulmonary sarcoid could happen. Ironically, people who have this happen too, because you're going to say, well, why do people get it in other places? Why is it in my skin? Why is it in my eyes? Is that these cells, these immune cells that get programmed to the antigen, can travel all throughout the body, and there's some evidence that they will travel to distant sites where other lymphatic tissue is and make granulomas form there. We've been, struggling for a long time to understand how people get granulomatous inflammation in parts of the body where the environment doesn't touch. Like normally the central nervous system, this is Angelo Gaffo, who doesn't have gray hair, by the way. They call me old. How people get certain sarcoid in the central nervous system that is normally protected from the environment. And so that's been an area of intense interest. And you can think about it this way too, that the three most common places, if you look at people with sarcoid in different places, not the only way, but the three most common, are that people get lung sarcoid, they get skin sarcoid, they get uveitis or optic sarcoid manifestation. And all three of these places are places where extrinsic antigen, the world, comes in and touches us. We breathe in stuff, we can absorb antigen through our skin in certain circumstances, and our eye is exposed to antigen in a lot of ways. And so, I'm not telling you this is exactly the way that it happens biologically, but there is some biological evidence that what we encounter here are places, this antigen model is where we have the most common manifestations of sarcoid in people, in large groups of people. And so it behaves in a way like that. Now this conversation I have with patients a lot in clinic, and they'll say, okay, this is like one of the most common questions I get. What kind of sarcoidosis do I have? And so that's an honest question, it's a good question, and it's a really global, broad question. And I'll have to think for a minute and I'll say, okay, vanilla. No, I mean, I have to pick a kind. So when I started describing this to patients, I realized that there really are two kind of general groupings of patients with sarcoid. It doesn't matter where, what kind, or how it is in the body. One group of people has this inflammation that forms granulomas in the lymph nodes only, in all the lymphatic tissue. And so you could think about it, the tonsils, the lymph nodes in the chest, the lymph nodes in the pelvis. There's lymph nodes and lymphatic tissue in the spleen. Though it occurs throughout the body, and we're made that way so our immune systems can monitor for infections and get rid of infections. And these lymph nodes can have granulomas form in them in patients with sarcoid. And when they do that, their disease will become active and these granulomas will release these inflammatory particles and cause the patient to feel bad. And in this case, they can have anything from night sweats to skin rashes to joint pain to fatigue to all of the above and plus some other stuff. And so this lymphatic inflammation causes a lot of symptoms, but their organs work normally. And then in this other group of people, what you'll see, like for example in the lung, these granulomas will form and multiply and they will replace a certain percentage or a certain amount of the normal tissue. Now there are patients who have progressive lung disease, progressive lung sarcoid, and their lungs are being, for lack of a better word, more granulomas are forming and then causing scarring in the lungs and they lose tissue. And that can occur in the lung. It can occur in the liver with fibrosis or scarring. It can occur in the kidney. And pretty much any organ that you can imagine or have ever heard of, it can occur. So these patients have shorter lifespans in generally because they are losing an organ function. And unless we can find a medication that they can take that would stop this process from happening. And these patients, although they overlap a lot, sometimes they fall into these distinct groups where they will have completely normal organ function, but they feel terrible and they have a lot of morbidity and they have to take medications to treat this inflammation, and the medications themselves can also cause side effects and symptoms because there's no perfect medication, but there are some medications that are better for patients than others. So I tell people a lot of times, you're this group. You are this group with we've done testing, your lung function's normal, your kidney function's normal, your liver function's normal, but you have a lot of lymphatic inflammation and you're going to have a lot of symptoms and we have to make a decision to treat them or not based on how much they're bothering you and how much the medications may make you feel better or worse. And in this group, we will have patients come to clinics, it doesn't matter which clinic, and we will say, okay, you have now lost lung function on a breathing test. We don't have a choice now except to do some treatment for this. Or your heart function is going down because on an echocardiogram you're starting to lose heart function. So I think of it in a way, in a very practical way when I'm talking to patients, that you have one of these two. Now this group of patients often has this as well, but the treatments sometimes are different, and a lot of times people who have lymphatic inflammation only will use lower tier medications or different medications, and will try supportive therapies. But generally it works in a way this way globally. It's a very broad way to think about the disease. So how many people does this disease affect? Well, I'm going to tell you first off, we don't know real well, because even though we're getting better at diagnosing it, education for people who do diagnose it really needs to be still more disseminated. And there's probably any estimate you might see about how many people have sarcoid is almost certainly an underestimate, because it's hard to find sometimes, and it's hard to diagnose and get an estimate on population numbers of a disease when the disease doesn't behave the same in different people. So if you thought about a different disease like pulmonary fibrosis, which is the same generally in all people, it looks the same on CAT scans, sarcoid can affect numbers of different organs in patients and different combinations of those in people, so it's hard to get an idea of true numbers. What we do know, kind of from a couple of population studies, this is actually from the Optum database from 2016 or 2015, and this is what Dr. Baughman and some other people found, that this is incidence and prevalence of the disease, and you can see it kind of follows a similar curve, and that this is African American patients, and this is Caucasian patients, this is Hispanic patients, and these are Asian patients. So you can see there's a huge population of incidents, new cases, and a huge population of existing cases of somewhere around 141 per 100,000 people that are African American with sarcoid. And same thing here. And so we see where we live in the continental United States that a large group of patients who are African American have sarcoid. And we see a slightly lower number of Caucasian patients with sarcoid, and then among Hispanics and Asian ethnicities, it's lower. But that doesn't mean that someone who is a Caucasian patient can't have severe sarcoid, and a person who is African American always has severe sarcoid. That's a generalization. But we do know that it affects quite a bit of people. This is from Henry Ford Health System. This is from the Access trial, which was done quite longer ago when they started trying to make cohort studies to understand not only how many people in an area have sarcoid, but how many people in families have sarcoid. And this is a majority of this cohort is African American patients from the Detroit area and some other supporting systems that were part of the Henry Ford healthcare system, which still exists. And so this was published way back in 2001. And they did this age and sex adjusted kind of maneuver to understand that, and they saw that if you were African American in this population and you had sarcoid, that you have almost 2.5 times more likelihood of one of your relatives also having sarcoid than people in the general population. And the familial risk for parents was higher as well, and so we see that it tracks in families, and particularly in African American families, although that's not exclusive. So among African American patients diagnosed with sarcoid, particularly if they're younger, in the 20 to 30 range, they're highly likely to have another relative with sarcoid. And many people that I talk to have cousins or uncles or aunts who have sarcoidosis, or people they know in the community who have it. And so it's fairly prevalent. There are families of Caucasian patients who have it, and it tracks in the population that way. And then this is actually interesting. This is from the Black Women's Health Study, which was a questionnaire that was started among magazines to follow health among African American women. And so it was a health survey. It was sent out by mailings. It was sent out through magazines that are purchased and read, like that you would buy at the grocery store. And the people who participated in it would send in their information voluntarily. They would fill out a bunch of different demographic information. Predominantly it was African American women. That's what the study was designed to look at, like high blood pressure, heart disease, those kind of things. And so they would send in information, and then they would follow those people for several years. And 59,000 African American women were contacted, and most of them sent back stuff. That's a tremendous amount of work to get that many people into a study or a registry. And they found that this research study was not designed at all to look at sarcoidosis. It was designed to look at heart disease, breast cancer, things like that. But people had a way to write in other diseases. So it said at the bottom of the survey, you would fill in little circles like, do you have heart disease, yes or no? And at the very bottom was a slot, and it says, do you have other diseases? And people would write in lymphoma, whatever. And it turns out that they found right off 685 people with sarcoid. And so the people who were doing the study said, wait, we really should follow this. We should redesign this or change it so we can track this disease as well. And then they found 435 new cases from 95 to 2007, with an incidence of around 71 per 100,000 patients from this cohort. And when you break that down by numbers, if you look at this group of people by other diseases they reported, as many people in the 30 to 40 range that were African American women who said they had new diagnosis of breast cancer, had new diagnosis of sarcoidosis. So it actually, among certain populations, is very prevalent, and it actually shows up a lot, and it's probably underdiagnosed. And so among all people, regardless of what your skin color or your ethnicity is, it is a disease that is elusive and needs to be understood better, and we don't have a great way to understand how many people have it. And we are struggling with that, but we continue to try and get a better model. And how does it affect the body? Well, it's most commonly seen in the lungs, the skin, and the eyes, but really that's, most common is about where that stops. It can really be anywhere in the body where there's tissue. I don't think there's anywhere that I haven't seen it in a patient at some point in time where they have sent us people from the reproductive organs to colon biopsies to everything else. And this is what it looks like, and you'll see some more slides about this from Dr. Acosta, who's one of our newer and brighter excellent clinicians, that this is what pulmonary sarcoid looks like when it's really not being nice. And it can fill the lung with these granulomas, these white areas where the lung should normally look black. It can also affect the skin in ways that are anywhere from mild to horribly debilitating. And this lady had these large plaque-like lesions that cause lots of hair loss. There are patients that you'll see in some other slides today by one of our great dermatologists, where it can cause erosive lesions anywhere from I've got a small thing on my back and I don't care about it, all over the spectrum. It can cause debilitating joint disease, and this lady used to play the piano and she doesn't anymore. And this is actually a lady we used to follow in clinic who has now chronic arthritis mutilans, which is a form of sort of destructive joint disease where she actually doesn't feel this anymore. It doesn't hurt, but she can't have, her fingers are no longer straight from sarcoidosis. And it can cause this obliterative disease of the eye, which leads to blindness in different forms, anywhere from uveitis to different manifestations that are mild to patients losing eyesight altogether from it. And this is a very special patient we don't see anymore because she died, and we took care of her for many years. This is actually in the vertebrae of her bone on a PET scan. That's how it was diagnosed. So they thought she had cancer. She got a needle biopsy of her spine, and she had granulomas only. We ended up treating her for some time. She had progressive disease despite treatment, and passed away probably about 4 years ago, but she had disease in her bone in many places. So if you could imagine it, it can happen. This is actually somebody with cardiac disease. You can see on this scan that she's got quite a bit of activity here in the muscle of the heart. You'll see some more about that from Dr. Marshall. This patient's doing just fine now, but she's on treatment, and she works with us, ironically. So I saw this person lots of times in the hospital, and then she came to see me and said, hey, I've got a cardiac disease, and I need to see you. So if you could imagine any part of your body, sarcoid can affect it. And then how do people get diagnosed? Okay, so people with sarcoid often present with these vague symptoms. They'll be undiagnosed for some time. They'll have joint pain, sometimes migratory joint discomfort. And these evaluations for sarcoid with a biopsy require excluding other things like infections. And so many times we'll take biopsies and watch them for a while to make sure the patient doesn't have an infection in the granulomas. And then there's these three general clinical scenarios. Generally, people present, although not always, with these three manifestations. They'll either have these skin or diffuse joint symptoms, which prompts an evaluation. Something shows up visibly, or they can show you that it has happened. Somebody says, I've got this skin rash, they get sent to the person's biopsy. Sometimes they'll have this shortness of breath and cough that leads to them getting a pulmonary evaluation. And then sometimes they'll get a chest x-ray done randomly, and they'll have these lymph nodes that get biopsied. So that's generally the big picture, and now you get to see some much better talks about the specifics. Thanks for your time.